Anele Siswana, a clinical psychologist, joins us now for more on this discussion. A very good evening to you, and thank you so much for speaking to us.
Good evening. How are you doing?
I'm well, thank you. So, at some point, the Human Rights Watch organization estimated that around 600,000 South African children with disabilities or special needs were not at school last year. And as we've heard from that report from my colleague, it seems that it is a fate that many face. But is it commonly faced, though, children with special needs not having a place to go to in terms of schooling?
I guess it's really a common phenomenon. Reality is there's more demand than the resources that are there provided by the Department of Education. And obviously in this case, educational psychologists are in a much more better space around giving us a better perspective of what could be looking like. But if you look at the current demand, I mean, there was a great mention of autistic children or autistic learners in schools. A number of teachers are not entirely really trained in understanding some of these complexities that then come with being a learner or that presents with autism or dyslexia. So there's a greater demand that then requires particularly foundation phase teachers to be trained with mental health skills, particularly around autism and how to go about supporting or providing support, mostly around the diagnosis of these learning disorders. At the same time, people who would be really trained around how to diagnose or how to make sense of an autistic presentation. But if you look at our current system at the moment, it doesn't have sufficient capacity to accommodate a number of these learners, particularly in rural areas and in township schools, because that's where we see the greater demand.
And you talk about autistic presentation, and I'm just thinking the lexicon is definitely or surely widening in terms of what we previously understood as special needs and difficulties. Are there enough education drives, particularly in far-flung areas where parents are taught, if healthcare practitioners, for instance, are themselves able to identify some of these things early on?
I think it's important to highlight the fact that autism on its own is not a learning disorder. However, with an autistic picture, you can have a child that struggles with comprehension for writing, comprehension for reading, social skills and aptness in terms of that. And so if we're going to look at that, then we're going to have a greater understanding that then suggests that a number of our educators need a lot of mental health literacy and education, which could be part of the curriculum, which will then help them with the most fundamental skills that they need around. They may not necessarily do an assessment, but just a form of literacy and lexicon that will then help them to at least see the symptoms, see the severity of these symptoms, and then be able to then suggest that an educational psychologist is needed that will then work around the intervention. But as we stand now, I think there's more work and research that needs to be done as to how do we capacitate educators, particularly at foundation phase, which will then be able to work hand in hand with families and communities in placing these learners in right placement so that they do not suffer on the mainstream context. But we do need some greater sense of awareness around the department, capacitating educators with the knowledge and understanding around mental health disorders that they would then understand and be able to refer appropriately when there's a need.
I mean, there's also a tendency to lump together certain categories of vulnerable peoples or members of society. So the manner in which you cater to them surely must be varied. So if you're looking for, or should I ask, what are the basics at any special needs school that cater for students who have special educational needs, that will cater to the type of difficulty or challenge that a child would face?
Yes, the challenge that we're sitting with at the moment is that of demand, as I mentioned. And so if we really have educators that have the skills and knowledge and understanding, this will somewhat really help. At the moment, there isn't a classification of, let's say, in a special needs context that really has these fundamental specifics of what then needs to be done. You find these special schools, in my understanding, they are quite generalist in their own nature. So if we are really going to do justice, we need to categorize these placements, because if you look at learning disorders, in their own presentation, they range from mild, moderate, severe. And so if we can have a system that accommodates for that variation, it will assist with the level of placement and also with the context of where we are now. There's a greater sense of it's very clustered, it's not clear, it's not so succinct in terms of how do you go about assisting and availing these services, because at the moment there isn't a clear model that then really helps with the placement of these learners.
And just in terms of because I'm thinking we're speaking at a high level as if people would understand. You may not be confronting that problem yourself, but just to be aware, because I think as a society, we in South Africa, the ethos is that of Ubuntu. We talk about it taking a village to raise a child. So how do you identify a child with learning difficulties or even physical disabilities, behavioral problems at school, so that you may be able to lend a hand and not be the cause of agitation, frustration, or even despair?
I think this is where now it is important that with the education, with the Department of Education, we really focus on mental health literacy and mental health awareness that will help learners, families, HDBs, and communities with the actual language that then helps us to understand what mental health is. And obviously, when people talk mental health, we're looking at what is visible, that is the presentation of the mind, or when we see this person wonders, when we see this person is not doing so well, whereas there are invisible mental health conditions, and one of them would then include a range of these specific learning disorders, which then affect the quality of life of a child. So I think we need more interventions and more programs that focus around mental health awareness and literacy in helping educators, helping communities to also demystify the stigma that then comes with these learning disabilities or learning disorders, and really help communities to say, when a child or a learner presents with this presentation that is so difficult even for them to understand, how then do we cultivate a healthy, conducive environment that also would not force this child to be like a mainstream child, but create a conducive environment that is supportive, that is understanding. But before we can get to support, we need a context that has the lexicon and the language that then understands what is mental health, how do these mental health conditions present themselves, what are the symptoms. And so if we can work around that, I think there's somewhere where we can go with the department, because there's a greater need of destigmatization, particularly for learners who are really struggling and come from families that do not understand. This is now where we're going to see a greater part of learners that attempt suicide because they can't find belonging in these mainstream contexts. And so if there is more mental health literacy and more mental health education, we will see less problems in our educational context.
And certainly a conversation that needs to be had again and continued. Thank you so much for speaking to us, just talking about the plight of special needs learners around the country in the Eastern Cape. That is Anele Siswana.